From the global headquarters of the Asgard Company in beautiful downtown Wichita Falls, Texas. From the finest mind in the modern fitness industry. The one true voice of the strength and conditioning profession. The most important podcast on the internet. Ladies and gentlemen, Starting Strength Radio.
But yeah, I mean, you'd be astonished though. There was this lady I operated on probably about 2 months ago. She came in with an aortic dissection or an aneurysm.
Oh, God damn. Where?
But so her ascending aorta.
Oh, on the way out.
Dissected
right.
both the arteries up to the
brain.
brain.
But up to the carotids?
Dissected her coronaries. I mean, she was...
How the hell do you save that?
Well, so we saved her. She's 72, 73, something like that.
God damn.
Comes in
you
dead.
Guys are good.
I mean, dead. Yeah, no blood pressure, blue. The blue is your chair.
Right.
And we operated on her, get her through all of that. And she lives in Florida, so she was up visiting her in-laws. Comes back, not her in-law, her daughter-in-law. Comes back to see me for a post-op visit, and she says, look, it's been 6 weeks now, 8 weeks. Can I go back to working out? So I'm like, this is astonishing to me because, most of my patients don't work out.
Mm-hmm.
So, well, what do you do? So she starts describing, I spend some time on the treadmill, I do some yoga, but I've been working with this therapist who now wants me to strength train. So I said, have you ever strength trained before? Yeah, I used to do it for years and years. I was like, start strength training.
Absolutely.
And, and for her, this was like, it was a revelation, honestly. That,
right.
You're actually going to allow me to strength train. I said, yeah, I mean, you have an injured aorta. As long as your blood pressure is fine, you'll be fine. And,
mm-hmm.
She lost tiny woman, 130 pounds, probably lost 20 pounds.
Oh, God.
The surgery and the recovery and all that.
Right. Needed to gain a bunch of weight.
So she's back in Florida under a barbell now, which is fantastic.
Good. That's fabulous.
So I actually told her, watch the podcast.
Yes, in fact.
Yeah, as a matter of fact.
Watch the podcast. Welcome to Starting Strength Radio. We're here this week with our friend Abeel Mangi. Abeel is a cardiac surgeon at Yale and has flown all the way down here to sit down and talk to little old me and little old you. And we're going to have a fairly wide-ranging discussion today about several topics, all of which will be of immense interest. Thank you for coming down, my friend.
Rip, thank you for having me.
Absolutely. So tell us a little about your background. You're 45, 46 years old?
46.
And how long have you been doing this, and where and why and how?
So, Rip, it's an interesting story. As when I was young, in my teens and 20s, I was, a high school athlete. I grew up overseas, but I had never really, foformally trained.
Mm-hmm.
So we had all exercise. Now you're talking like the late 70s, early 80s here. Mm-hmm. This is when everything was about, you got to run, you got to, do aerobic exercise, all that type of
stuff.
Just
like the military still believes today.
Exactly, right? So I remember distinctly my dad and we used to go on 5-mile long runs. We used to swim together, things of that nature. But very little in terms of, formal strength training, right? So there was calisthenics and, body weight stuff, but that was about it. Then I grew older. I went to medical school, surgical residency, which... back in those days, we used to work 100, 120 hours a week, every other night call.
Right.
I trained as a heart surgeon, started a family.
Right.
Right. So over time, what happened was I gained a bunch of weight. Became physically inactive. I hit that magic, 40-year threshold. And, one day I wake up and I'm, close to 300 pounds. And I got 2 little boys. You can barely pick them up and get them up the stairs. So for me, this was a moment that, something is not right here.
Light went on.
Particularly when you think about the fact that, every day, I'm operating on people who looked at that time just like me. So young guys, overweight.
It had to have occurred to you that this was going to be a problem at some point.
It's funny, right? You don't think of yourself as
a patient.
Exactly.
Right.
Until I went to see a doctor.
Mm-hmm.
I hadn't seen a doctor in 10 years.
Right.
Who says, guess what? You've got high blood pressure. You've got high cholesterol. You need to start you on these meds. Mm-hmm. So for me, I'm like, 43, 44. I'm like, this is crazy. I've got 4 kids. The youngest is 3. The oldest is 16. If this continues, I ain't going to be around.
Yeah,
It's just not going to happen.
You won't see him through college.
It's not going to happen. Particularly because every male on my father's side had a heart attack by the time they were 55. Every single one of them, including my father.
Wow.
My father and his brother were the only two who actually survived them. So the rest of them, never made it through. So for me, this was the thing. I had to change the way I was living. So one of the nurses in our operating room, so I actually got introduced to this through CrossFit. Her son owns a CrossFit gym up in Brantford, Connecticut. And so I started training with one of his brothers, who was going to come here with me, but we couldn't get the logistics sorted out. So anyhow, I started training. Within 4 to 5 months, I dropped 60 pounds.
Right.
As I was telling you guys over lunch today, but the first day I showed up there, he was like, show me a squat. I couldn't squat my body weight. I couldn't squat to the ground and back up. So yeah, this was scary. He had me ride the bike. I could barely ride the bike for 30 seconds. I was done that day. I was done.
Right.
Couldn't do anything more. So, but I said, hell, the first day was awful. The second day was worse. I said, hell with this. I got to get this. So I kept going back. And, here we are 2 years later. I got introduced to your stuff really through the internet first. And I bought your books, read all your books. My wife bought me, that seminar that I came to up in Maryland. That's where we met the first time. And, I've been training now consistently, strength training, for about 18 months. So I went from not being able to squat, without a barbell. Now, last week I squatted 355 for 5. So for me, that's is like
excellent. That's just excellent.
And guess what? All the meds are gone.
Good.
So
good.
One morning I'm working out with John in the gym, and I'm like, Jesus, I'm so lightheaded. And he's like, what, did you not eat? Did you not sleep? I'm like, no, everything's fine.
No, it's the beta blockers.
Yeah, exactly.
Duh.
He's like, you've got no blood pressure. So, that
You're 80 over 35.
Exactly. But that's exactly what it was. So,
oh, God.
So, I did it for myself.
Right.
And today, I feel like a different person.
Oh, I'm sure you do.
I actually met someone who I trained with. So this is about 15 years. I hadn't seen him in 15 years. This is 2 weeks ago. And he says, you know what? You look 10 years younger today than you did then.
15 years ago.
So it's incredible. I think, so for me, this is, it's a big deal, both personally and professionally.
Well, it is a big deal because of the fact that this is an interventional strategy that requires no medication,
right,
that works every single time it's applied correctly, that is incredibly inexpensive compared to every other single alternative.
Absolutely.
And is more effective. This is probably the most important thing. It's much more effective than any medication combination that could possibly be administered.
And I agree with you. 100%.
With no side effects.
Yeah. And as I was telling you, that's why I love this slogan on the T-shirt.
From Bill Starr's book.
From Bill Starr.
Yes.
But it is absolutely correct.
Yes.
And there's data to support it. We can talk about the data.
Yeah, let's talk about strength and longevity.
Yeah.
There's several things we want to talk about today. We want to touch on the effects, or why would a cardiac surgeon be concerned with strength training? And want to talk about the conventional approach to cardiac rehab and what a hilarious waste of time it is. And then we'll, we've got a couple of special things we want to talk about. But let's talk about the strength and its relationship to mortality. And I guess probably the thing to talk about first would be the fact that cardiovascular disease is neck and neck with cancer right now as the number one cause of mortality in the United States. And for the most part, the vast majority of cardiovascular disease is environmental.
Correct.
It's environmental, which means it's your fault, not his. It's your fault. And you can fix it if you want to. But what we see is they don't want to fix it bad enough to do anything hard
Yeah.
because they have been perhaps told that there's a pill
Yeah.
or some combination of pills that will fix this. And that is just not true. And it's unfortunate that this is what everybody believes.
Yeah.
Since everybody believes that, it's extremely difficult to penetrate with the message that you have to get up off of your dead, lazy ass and fix this yourself. It's not a comfortable message for people.
No, it's not at all. I mean, I think, if you look at the context of this disease, so cardiovascular disease has been the leading killer of both men and women in America for decades, since the 50s. It's now neck and neck with cancer, depending on who you read. Cancer maybe a little bit ahead now, but regardless. The most commonly performed operation that we do, coronary bypass surgery, we do 500,000 of them a year in this country. Every year.
500,000 bypass operations.
Bypass operations every year in this country. And just to put that in context, there are about 5,000 heart surgeons in this country practicing today. There is expected to be a shortfall of about 30% of qualified cardiac surgeons in America in the next decade, simply because you can't keep up with the demand. The demand is exploding.
Because you are creating the demand.
Well,
Because you will not do what it takes to not have cardiovascular disease.
I mean, let's think about it, right? Like 2/3 of us are overweight. Diabetes is epidemic. And we can talk about the role of the diet, the role of governmental recommendations.
The role of the promotion of carbs over
Correct.
fat.
It's based on
starting 30 years ago.
bad science.
Yes, it's based
Bad
on
science.
Ansel Keys.
Exactly.
Is who
Right?
it's based on.
Exactly.
Ansel Keys.
And if you read, his famous study, the 7-country study,
Yes.
right? That study is fatally flawed because it was
It
cherry-picked.
should never have been
It
published.
should never have been published.
It shouldn't have been published, yet it forms the basis.
Yes.
To this day, as far as I know, unless they've changed it, of the American Dietetics Association's recommendation for a low-fat diet. They still recommend a low-fat diet.
You look at the American Heart Association, American Medical Association, every major professional society recommends whole grains and low
Lots
fat.
of them.
And low fat.
And low fat.
So
and
carbs should
it's-
account for 70% of your caloric intake.
That is a recipe for diabetes.
Absolutely.
And it always has been. And lots and lots of people have made these observations for lots and lots of years.
Yeah.
And yet, the dogma with professional society still remains incorrect like this.
Yeah.
And it's I think that everybody that's interested in it at any level already knows this because of the availability of the information.
Correct.
And but nonetheless, a large percentage of the population are still under the influence of their doctors.
Correct.
Who have not taken the time
And who don't know this.
Who don't know this.
People don't know this. This is not taught in medical school.
No.
Okay. So when you get food out of a box that says healthy on it, that should make you pay attention.
Yes.
It's not food if it's coming out of a box.
No. Food does not come from
Food does not come from boxes. Food comes out of the ground or of an animal or
Right.
something like that.
Or something like that, but not out of a box.
Yeah.
Chances are anything out of a box is extremely high in carbohydrates.
And it's processed, heavily processed.
heavily
right?
processed.
So that's all the stuff. So that, you look at cholesterol, right? Hypertension, cigarette smoking. These are all things that we can do something about by exercise.
Yes.
Right?
I wonder, just as an aside, what percentage of cancer versus what percentage of cardiovascular disease is environmental. I get the impression that essentially all cardiovascular disease, with very few exceptions, are environmental. That, in other words, you cause that. And a quite a bit lower percentage of cancers are environmental, although the majority of cancers remain environmental.
I think it gets hard to tease this out. I think that for most conditions, I think reasonable people could agree that there is a component that you were born with. There's nothing you can do about that.
Right.
But there is a significant component that you do have control
Yes.
over, right? By the things that we're going to talk about.
Yes,
And it's the
type
same
2
for-
diabetes
yeah,
is
it's the same for
essentially
cardiovascular disease.
you
same
give
for
yourself
hypertension,
type 2 diabetes.
and it's the same for cancer,
Right.
right? So if you smoke, if you choose to smoke, odds are, you're escalating your risk for many different types
Certainly.
of cancer, right?
Certainly.
Similarly, with there's good data emerging that consuming processed food can also lead to the metabolic derangements that lead to cancer. So that there's good data, again, to your point, that a considerable amount of it is environmental. But with cancer, I think it's it's
Probably
it's a little
more
complex.
probably more complicated than the typical scenario of metabolic syndrome
Yeah.
that you find that leads to cardiovascular disease. I think probably the vast majority of cardiovascular disease, especially that which is the responsibility of metabolic syndrome, is your fault. Once again, it's your fault.
And it's tough, Rip, right? I mean,
Sure.
the thing is, like, I get it. We as human beings, I think, are conditioned to seek out short-term gain as opposed to long-term gain.
Yes.
Right? We will often sacrifice long-term gain for something that we can take advantage of in the short term. So, to your point, it's not easy to get up and train 3 days a week. It's a hell of a lot easier to take a couple of pills. Because
Sure.
what the hell?
And to a large extent, normal human behavior mitigates against strenuous activity.
Yeah.
Now, if you think 30,000 years ago, when life was tough physically, just inherently, the smartest thing you could have done is not kill yourself, not work real hard, because that puts you at an extreme disadvantage in terms of the use of your own physical resources, this sort of thing. The advent of modern society has changed that equation to the point that if you behave in what would, in a simpler time, be a self-destructive way, you're running. Now, why would 30,000 years ago, why would a guy go out and run for no particular reason? He has to run every day anyway. Why would he lift heavy things for no particular reason? That's part of the day. All his life, it's part of the day. But now, it's important that you place yourself into a set of physical conditions that more closely mimic what we're adapted genetically and what we had evolved to do. So that if you obey your natural proclivity to do things the easy way, now it's detrimental.
That's right.
And you have to, and so it's kind of counterintuitive. And I understand why people would rather have a pill, because it's easier, and easier is what we evolved to head in the direction of. But we don't have that luxury anymore.
Correct.
We have to understand that a strenuous lifestyle must be voluntarily undertaken, or we suffer the consequences that come with the fact that we are not genetically adapted to a leisurely lifestyle.
Right. And I think as human beings, I think that we should be putting ourselves in uncomfortable situations, whether it's intellectually or, physically. You that's the only way we grow.
Stress
as human beings.
is normal.
Correct.
Stress is a normal
Correct.
component of physical existence.
Correct. Without stress, there's no adaptation.
Without stress, there's no adaptation, and the adaptation then becomes to take us down
Correct.
in physical capacity as opposed to up in physical
So
capacity.
it's a maladaptation.
Right,
as
it's a
opposed to
maladaptation.
positive
It's nonetheless an adaptation.
Correct. Correct.
To the stress. The stress is a negative stress instead of a positive stress.
Correct.
And stress is an interesting thing. We talk about the stress recovery adaptation cycle as the basis of the construction of the method by which we train people. We apply stress. We create the conditions for recovery from the stress. That stress, when recovered from, produces an adaptation, and then we produce another stress.
Right.
And this escalating stress produces an escalating adaptation, and that's the basis of the method. I think cardiac rehab and all types of physical rehabilitation suffer from a logical continuity here. All right. If I was going to rehab a person with an injured knee, all right, knee's been operated on, you come in the gym 2 or 3 weeks post-op, and we start loading the knee through as full a range of motion as we can load the knee, because that's where the knee is going to return to function.
Correct.
It has to return to function through this full range of motion. So what we do is we seek out the greatest range of motion that you can operate in the context of the injury, load it progressively, go up 2 pounds of workout, 5 pounds of workout, just like we would do for a novice trainee. And what does the knee do then? It adapts to the stress by healing itself up in a way that returns it to function. In other words, it goes back to normal morphology. It heads in the direction of original equipment. It won't ever get back to completely original equipment, but it gets back.
You get it pretty close.
You can get pretty damn close with it. But the process of stressing the knee occurs in the gym every day, and outpatient physical therapy doesn't do that.
No.
Under normal circumstances, and outpatient cardiac rehab doesn't do that either. And the reason I think, and you tell me what you think about this idea, the reason I think they don't is because those people, that profession, those two professions, cardiac rehab and physical therapy, have the idea that the stress was the injury or the surgery, not something that they must apply in an escalating, accumulative fashion in order to return the structure to normal function. What do you think about?
So I think you're onto something here, because and this is important to understand, because I think once you have had heart surgery, let me just take a step back. The reason I wanted to become a heart surgeon is that it is one of the few areas in medicine where you do something very invasive, very big to someone.
Very, very
But you know what? The next day, they actually look better than the day they did before the operation. Okay? Because you have restored blood flow to the heart.
Right.
You've either fixed a leaky heart valve or a stiff heart valve. You've replaced an aneurysm. You've actually improved the functioning of that heart.
Right.
Okay?
And even though the procedure was invasive,
yes,
the function has improved as a direct result of the intervention.
Exactly. That's the goal of the heart operation, right? We don't do heart surgery to make people look better, to cure certain symptoms. We do heart surgery so that people live longer.
Right.
That's the only reason
hearts
to do heart
work
surgery.
better.
The heart works better.
So the heart works better immediately after the procedure.
Right? So now the question is, why don't you stress that heart during recovery?
Right.
Now I can tell you. Let me make an observation.
Okay.
You can take someone. This happened last week. You can take someone whose heart function is down to a third of normal. Okay. So normal ejection fraction of a heart's about 70%. That means it takes in 100 cc's of blood. It can squeeze out about 70 cc's. That's normal. You can take someone whose ejection fraction is down to about 20%. Okay. But under the appropriate circumstances, they can generate more than double the cardiac output that your body actually needs.
Post-op.
Post-op. Cardiac output is what actually matters. Is how much blood, how many liters per minute of blood can the heart generate to flow to the rest of the body.
So if the procedure is correctly performed, the heart is performing at a higher level immediately than it was prior to the intervention.
Unless you screwed something up.
Right. And that, of course, happens, but under normal circumstances.
If you do that, if you screw something up, they will usually not survive.
Right. The operation itself. Right.
So that the stakes are high, But because the stakes are high, the reward is also high,
Mm-hmm.
right? It's a high risk, high reward venture,
Yes.
right? So when you fix the heart, it has never made sense to me that when you send a patient out to rehab, that heart is actually not being stressed under controlled circumstances.
It's not being stressed sufficiently. They want to tell you that it's under a bunch of stress. We're going to meet a friend of mine tonight for dinner, and those of you that read the website, my buddy Scott Davison had a double bypass procedure, and he went through his cardiac rehab, and he decided about a week after he got through with cardiac rehab that he was going to come in and finally take the advice I'd been yelling at him for about 20 years and get in the gym and get back in shape and start training for strength. The first night, we did essentially nothing in the gym. Everything we did with an empty bar. We squatted, bench pressed, deadlifted, and I had him push the prowler back and forth one time. His report upon completing the prowler, which was the last thing we did, is that at no point during his cardiac rehab had his heart rate been that high.
Yeah.
And this is a bad sign.
Yeah.
You know, a lot of time has been wasted because he clearly survived that event.
Yeah.
He clearly survived that evening, and every time he has been in the gym, he's been severely ill a couple of times. He got sick and got dehydrated and had to be in the hospital a couple of days. I don't know what kind of bug he had, but there have been a couple of fairly decent little setbacks. But every time he has been in the gym, we have gone up in terms of the stress that we applied to that system.
And let me guess, he came off his diabetes meds? Came off his blood pressure meds?
They've got him almost off of all of his medication.
See, that's incredible.
They've got him off of his. We'll talk to him about it tonight.
Yeah.
I'll let him explain. But they had him on quite a bit of stuff.
Yeah.
He was not all full blown polypharma, but he was headed in that direction.
Yeah.
And all of that stuff's been cut back.
Yeah.
All of it's cut back to the point where he is. He's about ready. He could probably go off of everything right now if he needed to. And I've argued with him that he does need to.
Right.
And but it's a fascinating case. He was told in cardiac rehab to not just ride this bike.
Right.
Just ride this bike. Let's monitor your heart rate, and let's get that heart rate up to 65% of resting heart rate and this sort of thing. And at no point was he under any stress load. And the only thing that makes any sense to me is that instead of viewing the rehab as stress, recovery, adaptation, stress, recovery, adaptation, stress, recovery, adaptation, with that kind of a slope, that they think that the injury, the surgery, was enough stress, and that we don't want to stress the system in a way that would challenge the repair.
And the injury was so severe that it is something that no one will ever recover from or go back to a meaningful quality of life.
Apparently, all they want you to return to is baseline.
Well, I'll tell you what they want you to do, because I've actually studied this.
Let's hear this.
Okay, so at no point, so the target heart rate should be about 70 to 80% of your maximum expected
right, your
heart
calculated
rate.
maximum.
For your heart,
right.
age, sex, weight, etc.,
right.
etc.
Oh,
okay?
Right.
So the goal of the aerobic component of that exercise is to get your heart rate about 20 to 30 beats a minute above that. So we're talking
above baseline.
Above that 70% threshold.
Oh, above 70%.
So you're talking, that's a heart rate of 100, maybe. And most of these people are on beta blockers, right? So you're never going to get to 100.
You can't produce 100, right?
That's one piece. The second piece, the Borg perceived rate of exertion score, right? So how hard am I working from 6 to 20? They want you in the 11 to 14 range, so moderate exertion. This was a little bit difficult.
And our experience with the RPE scale is that no one can adequately judge that for themselves.
Yes.
Everybody's perceptions of what is heavy, what is hard, are inaccurate. Without exception,
yeah.
they're inaccurate.
Yeah, I believe it entirely. So once you've made it through these two thresholds, then you will start very light resistance training, perhaps.
Maybe.
Usually it's treadmill walking, so you may go up on the incline. But if you do make it a resistance training, then you're working at 30 to 50% of your 1 rep max.
Which they have no way of
Which they have
calculating.
no way of calculating. You're doing 2 to 3 sets of 12 to 15 reps, right? You're not supposed to Valsalva at any point. You're not supposed.
In other words, you're not supposed to squat, deadlift, bench press,
or do any or pick up any heavy object that you may be picking up.
Anything
in your
ever. Right.
Okay. So it should then come as no surprise that when you look at randomized control trials, looking at the benefits of cardiac rehab, there is no improvement in survival. There is no improvement in readmission to the hospital. There is no improvement in quality of life. And there's absolutely no decrease in cost of care.
Please repeat that.
So,
because this is so critically important. Just repeat those 4 points.
Right?
This is
so randomized controlled studies looking at the benefits of cardiac rehab. No advantage in long-term survival. No advantage in readmission to the hospital. No advantage in quality of life, which to me is the reason you should be doing this.
certainly.
And no decrease in cost of care.
So
if you think about the value,
utterly pointless.
what is the value? Where is the value?
It is utterly
Where is
pointless.
the value?
The way it is approached
Right.
in the conventional approach to cardiac rehab, it is utterly and absolutely pointless.
Right. So,
But everybody's required to do it.
you're required or you're heavily encouraged to.
You're heavily encouraged to
And
do
you're
it.
given advice about nutrition.
In some cases, your insurance company will refuse to pay for it if you don't do it,
Correct.
which is a form of blackmail. And I would hate to think that the cardiac rehab people had anything to do with that, but it has occurred to me. So I really, this is the. So cardiac rehab and physical therapy are basically the same thing. They are fatally flawed in that they are so conservative in their approach that they cause insufficient stress to produce an adaptation.
Correct.
And this is biology. This is if an organism receives stress from its environment, and that stress is not so large as to be overwhelming
Correct.
and unadaptable, then the organism will adapt to the stress of the environment and become capable of dealing with the stress.
And let's not forget, that heart has already endured the most stressful event that it will ever endure.
It's got your grimy hands on the damn thing
over
while you're... You're holding on to I've got this man's heart. So there's very damned little that he's going to be able to do to it that's going to approach the level of stress that you've applied to it.
Think about it. We've opened the chest. We've drained all the blood out of the heart. We've stopped the heart. We've cut open the heart.
You've slapped it around. You've
up.
made fun of it.
Show it who's boss, right?
And then, if it was a woman's heart, you were sexist to it.
Well, that's not
if it was a gay man's heart, you were transphobic or whatever. And then you put it back in.
I can neither confirm nor deny these facts.
Then you refill it with blood.
And then
that's probably the wrong temperature.
Oh, Jesus,
and then you restart the thing with electricity. You get a car battery. Right? But you guys are worried about making it beat too fast, right?
I mean, to me, it has never made sense. Never made sense.
No, it doesn't.
Now, particularly when you look at all the data. So let's talk about data and survival.
Right.
With strength training. Okay, so this is something. This is the question I asked you back in Maryland as well. That if you take all comers in the population and you make them exercise, what do you see? So the data are as follows. There's one study, take 30,000 adults, you make them exercise twice a week. This is only U.S. sort of physical activity guideline recommendations. This is not this is not strenuous exercise. This is 150 minutes a week or so. But these patients were actually followed for 15 years, which is what makes this interesting. So you're actually following the same cohort of
This
people.
is a pretty good longitudinal
Yeah.
study. What study is this?
So I'll give you the data. It's from the
yeah,
National Institute,
okay.
yeah? But what you see in this case is a 46% reduction in all-cause mortality. Take a bunch of adults who've never trained before, you make them exercise. This is strength training.
Mm-hmm.
15 years, half of them that should have been dead are still alive.
Are still alive.
Okay.
Well, no, this is pretty solid.
And this has been studied in multiple
evidence.
environments. So there's another meta-analysis, 11 randomized controlled studies, 300,000 patients followed over 9 years, 20% decrease, only strength training, 20% decrease in all-cause mortality at 9 years. Now, if you add...
And God knows what they mean by strength training.
That's a whole other... Well,
right. Another consideration entirely.
That's a whole other thing.
Right.
But now you add some aerobic exercise to that, 40% decrease. Okay, you study men separately, you see the same thing. You see women separately, you see the same thing. Now, the thing that surprises me is how few people actually strength train, and this is a very broad definition of strength training.
Right, very broad.
So we'll talk about
and
that.
As evidenced by the fact that the addition of aerobic conditioning to it actually improved the mortality, because you and I both know that.
We're talking single joint, machines,
standard,
machines,
Gold's
lots of
Gym
curls,
kind of
all
shit,
that stuff, right? So this is the Journal of the American Heart Association in 2017 looked at only women, okay? And 21% of women had admitted to doing any type of strength training in their lives. 20%, only 20%. Only 10% of women said they actually strength trained more than 1 hour per week. And when you looked at that cohort that was training for 1 hour a week,
again,
20% increase in long-term survival.
See, it's just...
So the question to me is...
And what's amazing about this, Abeel, is that this is so intuitively obvious to anyone that has considered this for more than a couple of minutes.
Let me tell you one fascinating study. Okay, this is out in New Zealand, and this goes to the point about physical therapy in general. They took any elderly, frail woman who came into their hospital system with a hip fracture. Okay, they operated on her for the hip fracture, and then took her and did formal strength training. So we're talking barbell strength training with little 80-year-old grandmas. Guess what they found? An 80% reduction in mortality. I mean, this is astonishing stuff.
Right.
And you look across the spectrum, Rip. You look at cancer. You look at diabetes. You look at high blood pressure. You look at cholesterol. You look at patients with kidney disease. You look at orthopedic patients. You look at patients with mental illness. Schizophrenics. Strength training improves survival and quality of life across the board in everyone you look at.
Yes. And
which, by the way, and that's why I love this T-shirt.
It is in fact true.
It is true. It is a truism.
It really is a truism.
It's a truism. It's a biological
Strength is
fact.
life.
It's a biological
Strength
fact.
is life. And everyone that's paid attention, anybody that's been on a farm, anybody that's had dogs and cats, anybody that has had brothers and sisters, anybody that has an old relative in the family knows that physical strength is associated with a long life and, more importantly, a productive life.
Rip, my dad is 84 years old. He squats.
Wow. See, this is and once again, and Dr. Sullivan has written about this in the Barbell Prescription. This is far and away the most powerful intervention that can be undertaken in terms of longevity and in terms of quality of life. Yeah. Far and away the most powerful. But nonetheless, people want a pill.
Yeah.
And, most people are always going to want a pill. And I don't know how to make people not want the pill and want to do stuff hard. There's the famous case, and I've talked about this several times. I had this has been 15, 20 years ago. I had a girl come in the gym with borderline, well, it wasn't borderline diabetes. She was waking up in the morning with blood sugars of 300.
Whoa.
And she was like 5'2" and 195.
Yeah.
Just fat.
Full metabolic.
She's 25 years old, and this is just, this is ridiculous. And so she wondered if I could help her. So I said, well, let's try. So I took her out into the gym, and I had her do some higher rep stuff. A little bit different approach than I normally take, which is fives, because I wanted to produce a glycolytic insult.
Yeah.
Is profound, a high rep glycolytic, just to burn up some sugar, just because I'd been experimenting with some stuff in terms of the effects of high intensity glycolytic exercise on insulin sensitivity and GLUT for this sort of stuff.
Yeah.
So we went out and did some sets of 20 on the leg press, and we benched and did some lat pulls, pretty much just real simple stuff, but all high reps. And I had her 6 workouts, and she came in on the 6th workout, and I said, "What was your sugar this morning?" She said 85.
Wow.
From 300 to 85 in 2 weeks.
That's incredible.
And she quit. She quit. Now, this was an interesting experience for me, because here you have handed this girl you handed her, if not
life,
that you handed her the key to continued health and life, and you've handed her the key to not shooting insulin, not taking glucophage, not having her feet chopped off, not having macular degeneration,
So why?
and blindness, but she quit.
Why?
Because I don't know.
See, this is
She just left, and it was I guess it was too hard. I don't know what it would. I mean, it was just a bizarre thing to realize about people. That here we are dealing with. We're dealing with.
This is
Here is the fix for you.
Life and death.
But I don't want that because it's too hard, and it's just God damn it.
Yep. People at work have asked me. They're like, "What have you done? You look different." I found the fountain of youth.
Yeah.
Which is I really believe that.
Yes.
I really believe that.
You did.
But the question is, the problem with this is that you require someone to be motivated.
Yes.
To keep coming.
Yes.
Because
And you can't motivate them.
But if this doesn't motivate you, then what?
What will?
If
your life, your continued existence doesn't motivate you, and amazingly enough, it doesn't motivate many people. Yeah. We have somebody in the seminar every weekend asked us, "What do I do? My mother, my father, they need this. They need this. They're fat, they're out of shape, their sugar's about out of control, their blood pressure's up. What do I do to get them in the gym?" And I said, "What have you explained the benefits to them?" "Yes, I have, but they won't go. How do I get them in the gym?"
Yeah.
And I have to tell them, you don't. You can't get them in the gym. You can't make people act like you want them to, which is what's largely wrong with many aspects of the government. And you can't make people act like they need to act, which is what is wrong with most of the human race. So there are profound hurdles here that there's no way to address those. There really is not. I mean, what we have here is the answer to heart disease.
Yeah.
To the conditions that predispose for heart disease.
Right.
We know what to do. We know how to fix this. This is not complicated. We know what dietary interventions to make. We know what exercise interventions to make. We know how to make you stronger. We know that getting you stronger makes you live longer. We know that a stronger person is a healthier person. We know that a stronger person is a happier person, a person who is more capable of carrying on daily physical activities that you run into when you're alive. We know all of this, but we can't do it for you. All we can do is inform you, and then you have to decide to do it yourself. And it's tough, man.
Rip, I
It's
texted
tough.
you. Yeah, so last Thursday, I texted you from the clinic, saying that
Yes.
I had seen 5 guys, all of whom I had done bypass surgery on, all of whom in their early 60s, all of whom had formerly been athletes, now all overweight, diabetics, hypertensive, blah blah blah. And so the question, I find myself in this funny position now of counseling people about their diet and exercise, which I don't think there are many heart surgeons. Usually it's, look at the wound and,
Right.
yeah.
Right. They're just mechanics.
Probably
most of them.
but I spent probably 2.5 hours with these 5 guys talking about diet, exercise, this. So then the question comes up: you guys were all athletes, and they're all former football players.
Right.
Why aren't you exercising? Well, initiative, etc., is one thing. Then the second thing is, well, where do I go, and who's going to train me? And certainly not for these guys because they're former athletes, but the little lady, that 72-year-old, she's like, well, these
How
barbell
does she
gyms.
answer that question?
Yeah, but
Right.
she's like, these barbell gyms are intimidating places.
Sure.
You go in there, you got a big guy like Nick who's squatting 500 pounds. It's like I'm not gonna
Right.
So how do we crack that nut?
Well, it's an interesting question. I think it is a normal human central nervous system response to be intimidated by people who are physically stronger or more aggressive than they are. That's a very old, deep in the brain stem kind of response, pecking order type behavior. And I don't know that can be fixed to the point where a 72-year-old woman is going to walk into a powerlifting gym and say, "Hey, help me."
Yeah.
That's probably not going to occur. So obviously what we would have to do is provide a different venue for her to go to that would show her what she needs to know about barbell strength training in an environment that is not intimidating to her, but that still encourages the kind of performance that you would typically associate with a serious black iron barbell gym. And the Starting Strength franchise gyms and our affiliate gyms are those places, and we just need to have more of them. We need more coaches. There's a demand for this product that exceeds our current ability to supply it. And we're doing everything we can to address that. But that is the answer. In other words, the answer is that the paradigm in an exercise facility must change from treadmills and cardio, this silly bullshit waste of time stuff that doesn't improve the health of a cardiac patient, and certainly as hell does not improve the health of a healthy person, right? To something that's physically challenging enough to make them stronger. And it's just going to take a long time before a strength adaptation becomes mainstream in the fitness industry. But that's really the answer to this. And it's a more broad availability of the correct idea of what should we be training for in a gym, strength, and how should we do it. Stress, recovery, adaptation, gradual accumulation of a strength stress and a strength adaptation. And it's just going to take a lot more education. It's going to take a lot more time. And unfortunately, a lot of people are going to die in the meantime. And that's just all there is to it. And that's not unusual. People have been dying for hundreds of millions of years and, just becoming protein for the system,
So our goal over the next 5 to 10 years is to make starting strength synonymous with get stronger resistance training, because when your colleagues recommend to somebody what they should do, because your patients are asking you what they should do, and they should not only say strength training, but they should say, well, how do I do strength training? Starting strength. And then it's just a top-down effect, because what's the old lady going to do? She's going to go find a trainer. She's going to say, my doctor says I need to do starting strength. The trainers are going to have to learn what starting strength is, and even if they're trying at it,
it's tough,
gonna
Nick.
be fine.
And he and his colleagues have the moral authority to say that to 72-year-old women, whereas we don't. They're just, what do we know?
Rip,
You know.
the relationship. So it's interesting. The relationship between a patient and a heart surgeon is a very special thing.
I think it is.
So
I've
when
talked to enough of them to know that it is.
When I was in medical school, people used to, my old elders used to say to me, aren't you worried that you want to be a heart surgeon? You won't have a relationship with your patients. Because, that usually you think of a primary care doctor, someone who sees you from your 18 to 60. And I'll tell you what, when I used to do heart transplant and artificial hearts, it was as though I was their primary care doctor.
You were their primary care.
They came to me
because
for
without you,
everything.
they're dead.
They're dead. So it's the
Yes.
same dynamic, for this little lady
Right.
or these 5 guys in the clinic last week. They want to know what I think about
Sure.
these important
Because you're
matters.
responsible for them still being here.
Yeah.
A
And what
primary
I
care
need-
physician to those kind of patients, primary care physician is a vacuum cleaner repairman.
But
You are the doctor
But
that
see-
saved their asses,
But to
and
Nick's
that's
point,
critical.
like what we should be imagining, and you and I have emailed about this, is some sort of partnership here. Where,
Yes.
we can partner. So if I have people that I'm like, look, here's someone who's motivated. This guy's going to show up. I just need to tell him where to go, where to
Right.
show up. And I know that he'll get a coach who's familiar with the things that he's endured in his life and how to get him up to speed. That I'm not just casting this guy out to someone I don't
Right.
know or recognize.
Right.
Right. Now, I have personal relationships in the community in which I live that there's some. It's not starting strength, but it's something else. At that point, anything will work.
Anything that's hard,
Anything that's hard.
that gets progressively harder,
Exactly.
will
Exactly.
force anything to force the stress recovery adaptation
Exactly.
cycle
Exactly.
upon someone who desperately needs the adaptation.
Correct.
But if they are in a situation in the exercise community that doesn't understand
Yeah.
that things must escalate, things must become progressively harder,
Yeah.
that exercise selection is not the variable,
Correct.
that load is the variable,
Correct. Doing water aerobics at the Y ain't
is
gonna
not,
cut it.
that is a bath.
It's not.
They're going to take a bath when they get home.
Exactly. This is what I'm grappling with.
Yes.
And this is why I reached out to you.
Yeah.
It's like we need to figure out a way together to at least start to pick away at this. I
Oh,
know you're doing it in your world. I'm doing it in my world.
I completely agree. And our reach into the broader community is at this point limited quite thoroughly by the general perception of the medical community of what we do.
Yeah.
They don't know.
Yeah.
They have no idea. What is the most common response to an orthopedic injury or post-op or anything else in the medical community?
Yeah.
Don't pick up
Yeah.
20 pounds for the next year.
Yeah. Nothing heavier than a book.
Nothing heavier than a book for the next year.
Yeah.
Don't Valsalva.
Yeah.
Don't get your heart rate up. Take these beta blockers
Yeah.
to keep you squarely on your ass.
Yeah.
And as long as people are willing to believe those professionals over us professionals, then we will be hamstrung. We will always suffer the short end of that
But
stick.
that's why there needs to be a partnership.
There has to be an education program, and Dr. Sullivan's book is an excellent place to start. The Barbell Prescription is an excellent place to start, but how do we get doctors to read that?
Yeah.
I don't know.
Yeah.
I'm damned if I know. I don't understand how we. I don't know about you, but it's been my perception that a very, very common attitude among doctors, and especially among both heart surgeons and orthopedic surgeons, is, hey, we got this. We're the professionals.
Yeah.
You're just a gym owner, right? We're the professionals, and what we say goes. And more important than that, we already know this. We already know things that you, as just a simple gym owner with, a average college education, can't possibly know. Because after all, my 136 IQ can't possibly match that of a doctor with 120 IQ.
You're right. They don't match.
I'm sorry they don't. Average IQ of doctors is 120, and I happen to be a little smarter than that. And, I'm not real bright, but
Well,
I understand
I've read
enough
your
to-
book, so I beg to disagree. But I think, look, I think that when one digs deeper,
Yes.
there within all of these communities, there are people who believe.
Yeah, there are people there are isolated instances
Yeah.
of people with their heads out of their asses. There absolutely are. But the problem starts in medical school.
Absolutely, I agree with you.
The problem, the medical education paradigm is the
It's
problem
about treatment,
here.
not about prevention.
It's about this, do this,
Yeah.
this, do this.
Yeah, it's
it's
prescriptive.
training.
It's prescriptive.
It's training. It's not education.
Right.
And I really hate to say that, but I'm firmly convinced that doctors are trained.
Right. Well, you're absolutely right.
They're not educated. They're
But
trained.
that's what we refer to it. It's
Right.
training.
Right.
It's
I know.
surgical training,
I've
right?
heard you say that, and that
Yeah.
can't be any more accurate. It's absolutely
It's
you're
training.
taught to do
You're taught to
things
do things.
in response to other things.
Just like
But you're not taught to think through. You have general physiology as a junior in undergrad,
right.
and that's never applied. As you get out of school, you
General-
quit thinking like
Look,
that.
I mean, I'll tell you from my own perspective, right? So, in cardiac surgery, we use physiology every day.
Mm-hmm.
But it is never normal physiology.
Right.
It's pathologic physiology.
Right.
Right. So,
Right.
I think that if you're open-minded, if we as a community are open-minded about this, you quickly realize that you can alter pathologic states. In fact, we do this every day. You're altering pathologic states in order to enable normal physiology.
As you observed earlier, the minute you're through with your procedure,
Right.
physiology has been
It's
improved.
better. You have to have improved it.
Or the patient dies on the
Correct.
table.
Correct.
One
Exactly.
of the two things occur.
Exactly.
Right?
Exactly.
And this physiologic response to the surgery must be continued with activity post-op.
That is
so
exactly
that
correct.
we get back on this trajectory
Right.
that we got to be on.
Right.
Right?
Right.
But good luck explaining this to
Well, your point is right on, because what I tell people is that if this is the normal survival curve of a population, you're currently down here.
Mm-hmm.
The goal is to get you back up here,
right.
right? Now, that's the long-term goal.
Right.
The operation is one piece of that.
Yes.
The
Yes.
recovery, which
It's
is
the
what we've
first.
been focused-
It's the first piece of
first
that.
piece.
It's obviously necessary.
And
yes.
the most hazardous phase.
Right.
That's the riskiest phase. Is when you're
because
actually in the
because
operating room.
that's where the greatest amount
Stress.
of invasiveness. That's the greatest invasion any human being will ever endure is having their heart in the hands of another human being.
Correct.
I mean, previously we only saw that with the Incas, right? And that was real unproductive, right? That was never survival.
Right.
But you guys you're one step away from that. You don't throw it off the cliff, but you are handling the damn thing, right?
Yeah.
And
So the question is then, how do you continue that? Like, why would you pay such a high hazard if you weren't going to
if you were
reap
not
all the benefit?
if you were not going to continue
Correct.
the trajectory
That's
that's
exactly right.
established by the operation.
So the way I
Exactly.
see it is, I have a role to play in this.
Yes.
And you have a role to play.
Yes,
Which
we
is
do.
Why we need to think about doing,
I could not possibly agree more. But until you convince your cardiac rehab community
Yeah.
that they are behaving in a suboptimal fashion with respect to causing that trajectory to be reestablished, then, I mean, this is the whole thing.
Right.
Over and over again, our discussion leads back to the fact that has to happen.
Correct.
But if what they're doing post-op does not directly contribute to that, if all they're doing is in there covering their ass
Right.
about a lawsuit, and let's just be honest,
Yep.
that's kind of what's going on, isn't it? They're in there covering their
It's
ass.
fear, Rip. People are afraid.
Sure they
You
are.
know, people are afraid.
Sure they are.
Look at being afraid is not going to help anyone get better.
But I think that the best point to take away from this discussion is that when you're through with what you do on the table,
Yeah.
if what happens in the OR goes like it's supposed to, and that, in other words, if you get out of the OR, you're already better than you were when you went into the OR, and as a result of that, you can now handle more stress than you could before. And now it's important to understand that you must be subjected to more stress than you were before in order to establish that positive slope of that line.
Correct.
You know.
In order to get you back on that slope.
Right.
Yeah. Yeah.
Absolutely.
Yeah. And I mean, there's so much more we could talk about. You know, like
I know.
why this is important and what it does to your whole body. And
Let's talk about some of these other topics, shall we? Let us, because I mean, we got you here, and this is an excellent opportunity to talk to somebody that's operating in his community at a very high level. What do you think about the pharmaceutical industry and its relationship to cardiovascular disease? What's good? What's bad? What's complete bullshit? What do you think about Lipitor? What do you think about the number one prescribed medication on the planet?
yeah.
What do you think about the effects of all these drugs? What do you think about the designed dependence upon this chemical intervention situation?
So this is a great question. And my answer may not completely satisfy you, but it's an honest answer.
Let's hear it.
Which is that I think when you're recovering someone from something as traumatic as they've been through a heart operation or a heart attack or something, I believe that there are certain types of medications that have their place.
Sure.
So aspirin,
Sure.
you know, a beta blocker,
Certainly.
some sort of statin, whether it's Lipitor or something else, but some sort of anti-cholesterol statin is important.
Anything to soften the blow.
You need these to get through.
Right.
You got to get through. Because don't forget, we're manipulating physiology. We're manipulating blood vessels. You don't want blood clots to form on the inside.
Right.
You want to get the maximum mileage that you can out of the operation.
Sure.
However, the question, though, becomes, is that in the long run, do you need them? And that's why I think that in the long run, by not exercising people the way they should be exercising, you're actually creating this culture of dependency.
Right. You're substituting medication for activity.
Correct. Because why do we need these? What is the goal of this? Is what's the goal of these medications, right?
Well, it should be to get you off of it.
No, the goal. Our goal should be to get you off. But what are the medications designed to accomplish?
Sure.
They're ultimately
Immediately post-op, we don't want a clot to form.
and it's my belief
And we know that they do.
that you
right?
don't want. You want to subdue the inflammatory
You gotta-
milieu
you
inside
gotta-
the body.
Right. You have to. If the inflammatory load is such that
It's overwhelming.
the inflammatory load itself becomes a stressor,
Correct.
then that has to be
You got to
mitigated.
mitigate that.
You have to
You
mitigate.
got to mitigate that. So that's the short-term goal. Now, what we also know about strength training is that over time, it independently mitigates this anti-inflammatory burden, right? So all those cytokines and interleukins and stuff like that, all that stuff gets down-regulated.
Right. And the amazing thing about exercise is that when you put in a medication, it usually has 1, 2, maybe in some isolated circumstances, 3 axes of intervention.
Sure.
But the system itself is so multivariate
Sure.
that you're going to have to take a second medication
To mitigate
or a
the side-
third
yeah,
medication,
yeah,
and
yeah,
in some cases mitigate the side effects of the first medication.
Correct.
And anything that can be approached from the level of the patient's physiology itself
Correct.
is going to be both more comprehensive
Yes.
and less invasive in terms of side effects.
Yeah, I completely agree with you, right? So
Right.
if you look at, what does strength training do? So at the level of the heart, it will cause the heart to enlarge as the human being doing the exercise enlarges.
Yes.
Right? So people get worried about this. This is that paper
It's
that
a-
you sent me, the question
right.
that you sent me. Why is this guy's heart enlarging? Well, it's enlarging because he's enlarging,
Right.
right?
It's enlarging because demand,
Correct.
the stress response,
The
the
heart
stress
is a muscle.
recovery adaptation. The adaptation is a muscle, and the
Exactly.
thing is going to hypertrophy.
It's going to get bigger.
But that so often gets interpreted by lots of people as pathology.
It's
not
not
pathology.
It's not pathologic.
It's
because
adaptation.
Exactly. And when you index it to someone's body mass or body
Right.
surface area, it is actually normal.
Yes.
Right? And what you will similarly see is when they stop training, just as your skeletal muscle will regress, so will the size of the heart.
Yes.
Right? So I know we had talked about that before
Mm-hmm.
via email, but that's why that's important to bring up. The other thing that is interesting that happens is that arteries develop elasticity
Yes.
when you exercise. So this is why hypertension is curable by exercise. When you're not exercising, the endothelium or the lining of the arteries is dysfunctional. It's critically dysfunctional. That's why exercise. That's why the blood pressure response to exercise is abnormal in people who don't train. You can actually get it normal by exercising.
Yeah.
Mitochondria efficiency in skeletal muscles, the number of mitochondria and how efficiently they extract oxygen, that goes up.
Sure.
All the genetic expression changes in as little as 6 to 8
Yeah,
weeks.
the system is so complicated,
Yeah.
so multivariate.
Yeah.
And this is why it's so damned hard to do research on these topics.
Yeah.
You can't tease out, you can't perturb one variable
Correct.
and correctly deduce the response to that one variable because
exactly right.
other variables participate in the response.
It is-
and you're not controlling them.
It is impossible to tease out causation.
It is.
All you can
you
defer,
can do
all
is
you can
correlate.
infer is correlation.
That's
which is,
all you
which
can
is
do is
not
correlate.
good enough. Not good enough. And then you look at other things like the whole, well, what are they doing? What is their definition of strength training? Usually it's
Right.
Leg presses and
Leg extensions and
Leg ex-
arm curls
yeah,
is what it
exactly.
usually it is. Resistance training, they call it. They don't even call it strength training.
Right.
Call it resistance training. It's on a machine and it's not systemic and it's not hard enough to produce an adaptation.
Right.
Yet it still
better
shows
than nothing.
positive,
Right.
statistically positive outcomes. And it's not even what we would consider to be resistance training at all, but it's still that powerful.
Right.
It's still a bad. So you imagine if you subject somebody to an optimum situation.
Yeah.
Like you're going to meet Davison tonight.
Yeah.
Davison he rack pulled 330.
Jeez.
No, 310. He rack pulled 310. And this is a guy with bad arthritis in his index finger on his left hand.
Yeah.
And he did that without any straps. And this guy was laying in the hospital bed 2.5 years ago about to die.
It's fantastic.
And
not to say what it does to your overall
it's
sense
just-
of well-being and,
yeah.
there's something to be said about
Oh, yeah.
picking something heavy off the ground.
Well, I told him a while back. In fact, I got him up to a 300 deadlift. It's been a while. I had him pull 300 off the floor, and he didn't think he could do it. At the time, he was doing a triple with 265 off the floor, and I said, I want you to put a quarter, a 10, and a 2.5 on that. And he goes, that's 300. I said, very good.
Good math.
Very good. Load it.
Yeah.
And he put it on there, and he was real apprehensive. And I just browbeat his ass into it. I said, pull it. Pull the goddamn thing. It's there. Do it. Don't be a pussy.
Yeah.
It's time to stand up and get this thing done. And he went over and deadlifted it. And I said, guess what, Scott? You're no longer a heart patient. You're now a lifter.
There you go. Yeah.
You're now a lifter.
Yeah.
And that's pretty cool.
That is pretty cool.
To hand a guy that, that's pretty cool.
Yeah.
You know,
Absolutely.
You're no longer a heart patient. And that was real important to him.
Yeah.
And it's a fascinating thing to see what can actually happen to people. And back to the medications thing, he's, we'll discuss all this with him tonight, but he's dropped several of these things that he was on.
Yeah.
He had a big handful of stuff that he was taking.
Yeah.
And like they had him on a beta blocker, and I think he's completely off of
That's
that
incredible.
because he was. I mean, at some point, it's not helping you.
No, it's actually hurting you.
It's hurting you. It's preventing you from having
exercise.
a normal cardiovascular
Yeah,
response
exactly.
to exercise, which is one of the stresses we want to impose on the heart for the adaptation.
Exactly.
And so he's off of that, and he's off of a bunch of stuff. Now I've got another old guy in there that just he's guilty of doctor worship,
Yeah.
and one of these criminal GPs here in Wichita Falls has got him on about 10 things, and he just can't bring himself to question
Yeah.
why
Why am I on this stuff?
and the guy keeps telling him, because I've got you on them now,
Just keep taking them.
keep taking them. And guys like that they're the problem. I know not all doctors are that way, but there's enough of them out there operating, especially in this demographic, in the older demographic, that are so quick to hand out a prescription. You got a symptom here.
It's all.
You got another symptom
It's
here.
all people know, Rip.
Yeah, I know.
But look at like
It's all the patients
But
know.
but 3 years ago, that's all I knew.
Yeah.
But so people.
And why do you think that is? Is it the lack of education?
It's not. I mean.
Or is it just a reluctance to think in terms of...
What was I trained to do? And
You were
want
trained
this,
to do...
I was trained to become a damn good heart surgeon.
You're trained to do physical repair.
Correct.
Yes.
Right? Under
This is
conditions.
a set of hand skills and a physical
I have to
physical
complete
repair.
a
You're
physical task.
You're a plumber.
Right? In
An
so many ways.
extremely talented plumber. But you're performing things with your hands
Correct.
that you get very, very, very good at.
And you have to get very good at it.
Yes. Oh,
right?
God.
Because, John Smith next door has a heart attack.
Look at these things.
Gorgeous.
Don't break them.
Aren't they gorgeous?
Don't break them. You'll have to feed my kids if you
You're not
break
gonna
them.
be boxing later today.
Yeah.
I'd love to
no.
box.
But so where does that limitation come from? Can you put your finger on
but it's-
where in your preparation is there?
You're not prepared
do
for
you
it.
not step back and look at the whole physiology
But
of the?
how many people have the wherewithal to step back from what they're doing every day? It's not many.
Well,
it's not
that's a
many.
very good. That's a very good question.
So many. We all.
I'm probably guilty of that myself.
But we all,
but
all are. We all are, right? I mean, for me, this was serendipity in many ways, right? Like
Right.
I realized, Jesus, look at this. I got to change, and it
Right.
changed, and it opened my mind, and then I, talked to you and
Right.
other friends. So, but a lot of people don't. We as surgeons, we don't take good care of ourselves. How many of my colleagues work out every day? Zero.
Well, that's a very good question. We get myopic.
Yeah.
Everybody develops a certain amount of myopia, and
And look,
your
and we live,
myopia
breathe, and
is-
eat this stuff. This
is
is
not your
every
own.
day. It's like 7:30 in the morning to whenever it ends at night. Every day I'm cutting and sewing. That's what I do.
right.
That's my sense of identity.
Sure.
And amongst other things, right? But that's how most of us think.
Yeah, and if that consumes, 95% of your time, there's not much time left
nothing.
for the
For contemplation.
for the macro view of,
You don't have
how all
time-
of these things fit
You
together.
don't have time to contemplate. You're there to solve a problem.
Right.
A life-threatening problem.
Problem is this aneurysm.
Yes, and I'm going to fix it.
I'm
And
gonna
he's gonna
fix
do
this
great,
aneurysm.
And once this one is done, I will fix another.
Yes. Then I've got to go down the hall
Then I got to go help one of my buddies.
Right.
Then I got to go pick up my kids, and
Right.
I got to help the kids with homework. And
I understand.
right, so
I understand.
so that's life, right?
So in considered that way, it is the rare medical professional that's going to be able to do the step back thing. Because of the inherent limitations of the schedule,
but I'll tell you something.
motivation.
But so one of the reasons that I wanted to talk to you guys about this, you in particular, is because you have figured out a way to make strength training something that resonates with someone like me, right? So when I read your books, it's fact, right? This is the physics. This is the biology. This is why we do things this way. That, to people who have empiric minds, that makes sense, right? So I'm like, who am I going to talk to?
Do you realize what it is about our system that appeals to you? It's the simple logic.
Yeah.
It's the simple logic. It's the taking all of the machines away. It's taking all of the commercial considerations of the gym away and going back to what is gravity.
Right.
How do we operate in a gravitational framework? What is the simple physical science in operation here? How do we design an exercise system that will make people stronger?
Right.
Why do we need to be stronger? What is strength? What are all these little basic concerns? And what comes out the other end of this pipeline is a very simple, straightforward program that works every single time it is applied correctly.
Right.
And the simplicity of the thing is the draw. The simplicity of the thing is the draw to intelligent people.
Correct.
And as I just in a recent podcast, I made the observation, and I know this is going to be offensive to a lot of people, but stupid people like complexity. Complexity appeals to stupid people.
You want to strip things down of everything that is complicated, reduce it to its simple essence.
Right. Lowest common denominator. And does the math make sense there? And if it doesn't, then the math's wrong.
And I'll tell you what, that's what good doctors do too. We do the same thing. You take something very complicated, try to boil it down to something that is not going to take a lot of time, especially in the OR.
Yes.
It's going to maximize the reward and minimize the risk.
Right.
Right? Because the duration of the operation independently predicts mortality.
Right. Minimum effective dose.
Yes. We're talking
Minimum
the same
effective dose. A very simple concept that's been applied for decades, for generations, the minimum effective perturbation that's necessary to achieve
the result that you're looking for.
The desired result.
Yeah, exactly.
Not more than that.
Yeah.
The minimum effective dose. And this is why 10 medications just essentially always reflects an absolute lack of analysis of the situation as a whole. Stepping back, withdrawing, big picture.
Well,
10 medications do not fall out of a global analysis.
What you're doing when you're giving someone 10 medications for cardiovascular disease, you're treating 10 different symptoms.
Yes.
You're not treating the underlying cause.
Right.
The underlying cause is all the stuff we talked
Precisely.
about, right? So William of Occam's razor,
Occam's razor.
right? Reduce everything down to one identifiable problem.
Yes.
That's what medicine's supposed to be all about.
The simplest analysis
Correct.
is almost always the correct analysis.
Correct. Exactly. So that's what we do day and night.
Yes.
That's why when I pick
And
up your
that's
book and I
right.
read your book, I'm
And
like,
that's- and you
this
recognize-
fundamentally makes sense
you
to me.
recognized
Yes.
it. It's the same process.
That's why the bar should be here and not here.
Right,
It
right.
makes sense to me. What
Right.
do I know about barbell training? Nothing. But the way you explain it, it makes sense to
Yes.
me. Right?
Yeah.
So when I go into my gym and they're like, it's back squat day and I have my bar down here and everyone has the bar up here, people are like, what are you doing, man? I'm like,
I got this. I got this.
exactly.
I got this.
Exactly.
That
I'm
comes
like,
in handy, doesn't it?
you do your thing and I'll do my thing. Right.
Right.
So
Right.
so
Oh, shit. Anything else you want to
No,
yak about? I think we've
that's,
covered most of the bases here. Okay. Thank you guys for joining us. Abeel Mangi, thank you for
Thank
coming
you,
down
Rick.
to
It was a
Texas
pleasure.
to talk to us.
pleasure.
And thank you for joining us on Starting Strength Radio. We'll see you next time.